Good afternoon, everyone. This is Terry Phillips, your facilitator consultant for the Heroin Task Force, and we are welcoming you to our final Heroin Task Force Community Partners Quarterly meeting for 2023, which is hard to believe. We welcome you here today. We're excited. We've got some really great information about our action teams, some networking opportunities, and we're really excited to have you here. So I'm going to turn it right over to Larry Nelson, who is one of our co-chairs for the official kickoff.
Thank you, Terry. I'm very excited to see that we have 40 people participating at this time of year. We know what a busy time of year it is, so we really appreciate your time. You're going to have an opportunity in the last part of the meeting to give some input to our 2023 action teams, to give them feedback on what they've done this year, as well as to offer some guidance for 2024. When we rebooted the Heroin Task Force, one of the things that we wanted to do was to have more flexibility than we had in the past. So as the heroin crisis morphed into the opioid crisis, that's morphed into the fentanyl crisis, we're trying to keep up with things and try to have our action teams do things that will address the current and future issues as we see them. So I just want to thank everyone for their participating today. And at some point, you're going to see the 2024 Community Partners meeting dates, and we hope that you can get them on your calendar as soon as possible, because we really appreciate the more people we have involved, the better. So Terry, that's all I had to say. Do you have anything
Perfect.
else, or should I introduce our county executive?
I do have a couple more things, so I'll go ahead and take that over.
Okay, thank you.
Thank you. I think most of us are pretty familiar with Zoom, but I know we all use different platforms. So just real quickly, we'll have you kind of stay on mute because there's so many of us today, but you can unmute for sure, asking questions. There's a video opportunity for you to share your lovely face with us today. And we really, if you can do that, we would encourage it. Trying to get that feel like we're in person as much as possible. We will actively, and we are, as you can see, actively using the chat. So feel free to do that. LeBron and I will be keeping an eye on that. And then there's reaction buttons at the bottom of your screen as well. You might have to hit the ... more to find them if they're not up immediately. Feel free to use those too to express yourself, as LeBron is doing right now. So thank you all for that. And then just a couple of other things. We always go through these meeting guidelines. These are kind of our group agreements that we've been using for the past couple of years. The hand raise feature is awesome. If you can't find the hand raise feature in the reactions button, unmute and we'll get you into the queue here for speaking. But hand raising is really great because it pops you right to the top of our screen. And again, we talked about keeping your mic muted temporarily while you're listening. Turn off other devices to reduce distraction, and be present, but also take care of yourself. If you need to step away, no worries. We're here for you. And then when you're finished speaking, complete your thought with "I'm finished" or "That's it, I'm complete," and that way we can move on to the next person. And our goals for today, we always are, one of our goals right at the beginning is to continue to grow our community network. We have consistently had between 40 and 50 people attending these meetings for the past couple of years. We have over 235 community partners on our email distribution list. So giving us an opportunity to continue to grow relationships and partnerships for doing good work is really important to us. We've got some networking questions teed up for you, so you'll have a chance to chat in small groups. And then, of course, we're going to spend quite a bit of time with our action teams. We've got some great work that they are prepared to share with you. A wonderful survey from our metrics and measurements team. So we've got a lot on the agenda going today. And you guys have the agenda, so I won't even go through that. Oh, one last thing. I'm targeting to finish by 4:20-ish or so, and I'm going to hang out. If you guys want to hang out, we call this a water cool conversation. If there are other items you'd like to discuss, I can create breakout rooms for you, or we can discuss in a small group something deeper. So this is kind of as people are starting to leave the room. If you want to hang out and chat, I think Larry will hang out as well, and we're happy to be here for you as well. And now, Larry, you can introduce our county executive.
Well, I just have to tell you that I attend some sessions at the National Association of Counties, and I found it surprising that in other parts of the country, people are still debating whether having Narcan available is a good idea or not. And it reinforced what I already knew, that we are ahead of most of the counties in the country in trying to address these issues. And one of the reasons for that is because we have tremendous support from our county executive, Paul Farrow. So it's my pleasure to turn it over to him for an official welcome. Thanks, Paul.
Thanks, Larry, and welcome everyone. I'm glad you're all here. I've got my holiday lights going in the background, trying to get a little cheerful here. I wish there was a little bit more white out there. I'm a snow kind of guy, especially if it's going to be cold. Let's have some snow. I do want to give you a quick update on what's been going on in the county. I'm not going to take all of the thunder. I know some of the people might have some other conversations later on during the event. A couple of things that are pretty exciting. You've heard us talking about Pulse Point, which is an app that's on your phone that helps out with CPR situations. We are adopting that probably beginning of the year. But the cool point is for us, we are adding on there where Narcan is located as well throughout the county. So you're going to be able to go onto this app and you're going to be able to tap it and see if there's Narcan within the area. So I think it's going to be a great addition. We're going to reach out to our partners throughout the county and the communities to see who wants to put their location on there as well so that we have it there. A couple other things that are going on. If you've been out in the movies, like my son was a couple weeks ago and texted and says, Dad, you know, I really don't need to see you up on the big screen. I see enough at home. We've still got the ads going out and we're getting some tremendous response on them with what people are hearing. They're understanding the use of Narcan, understanding the importance of having the awareness when it comes to opioids and fentanyls. So I think we're starting to get that message and it's starting to break through at all different levels, which is great to hear. We've got some in the jail system. We've got the MAT program going. So the medical assisted treatments are going in the jail. We're working on that. And I think we're getting some positive responses there. I had the opportunity last week to go out with Lauren Costner from our embedded mental health program. So we've got our social workers with the law enforcement and met with Justin, who's over at the dispatch center, and talked to him. It's amazing how 5 people, 6 people are making such a big difference when it comes to law enforcement and responding to mental health crises. I think it's something that we are going to continue to look at and continue to hopefully expand in the county. I am seeing great benefits when it comes to reducing the amount our law enforcement officers have to stay on site, dealing with truly a mental health issue, a medical crisis, and not a criminal or law enforcement crisis. So I think that's going to pay big dividends for us as we continue to look at the program. Good news on that. Brookfield's going to be coming in next year. So starting January 24, they are partnering with us. So we're going to have another embedded health social worker with them. Our crisis stabilization facility is going to be kicking off, and I think next week, I think is when we're doing the dedication for it. So we're getting close.
Paul, it's Monday, December 11th, 11 o'clock ribbon cutting, noon to 2 open house. People can come at 11 for the ribbon cutting or anytime between then and 2 at the Mental Health Center on Monday, December 11th.
Fantastic. And then you can come over to the courthouse on December 12th and have some cookies around 11 o'clock for the county exec's reception for all the employees. So My wife and I are diligently making about 2,400 cookies this year to say thank you to all the employees that we have throughout the county and what they do. There's a lot of good things that are going on. Like I said, we're continuing the ads with Marcus, our partnerships in our education that's going on through the schools, work we've done with SOFA and with Love Logan Foundation. Some great things I think that are working. As Larry mentioned, I had the opportunity to talk to the executive director at NACO, and he was kind of surprised with what's been going on here in the county. So he and I have having conversations, Larry. I'm hoping that we can take the models that we've created. And I said, look, we're not here to hold on to it. We're here to share it with as many people as we can. So I'm going to be out there. I'm going to be out in events next week with a bunch of the county executives from across the country, taking this information with us to see what we can do to get the message out throughout the rest of the state. And I think that's all I've got for right now. So all of you, I hope you have a wonderful holidays, have a Merry Christmas, and enjoy the new year.
Fantastic. And County Executive Fair, we always appreciate you coming. Thank you for being here. We'll get the next 2024 dates on your calendar. This is really important for us to hear from you. So thank you for that.
Thanks for having me.
All right. Have a good day. Great. Thank you. All right. I am really excited to welcome Kat Becker. And you guys can see my screen? Yeah, there we go. Kat Becker is the coalition coordinator for the Southeastern region area in Wisconsin here for the Alliance for Wisconsin Youth, AWY. The Heroin Task Force became a member, I think, last year, as I'm remembering, or maybe 2 years ago. And I want to publicly recognize Jody Ebbinger-Bentley, who's here, and Bree Lopez. I'm not sure if Bree's on, but they are our representatives for the Heroin Task Force on this Southeastern Regional Coalition. And what's wonderful about it is they are bringing back ideas, grants, educational opportunities that all of you have access to because you are part of the Heroin Task Force. So Kat is here today and going to spend about 10 minutes sharing all of that kind of information with you and how you can access it. So Kat, thanks again for being here. And I will let you be the sharing.
Perfect. I'm just going to pop some slides up on here. I know that might feel like I'm doing a full presentation. I'm not, I promise I wouldn't do that to you. But it's just a visual. It's nice to have a visual, especially on a dreary afternoon here. So yes, well, thank you, Terry. As Terry mentioned, I'm Kat Becker. I use she, her pronouns. I am coming to you from the Alliance for Wisconsin Youth. We are situated, the Southeast region at least, are situated within Community Advocates Public Policy Institute here in Milwaukee. And so we support the Southeast region. So I'm just going to run through a little bit of what the Alliance is and what we do and where we're coming from. Our title is a little bit misleading, right? Off the bat, you'd think, we do just straight up youth development or anything under that umbrella. We do work with youth as well as every other sector of the community. So the name is a little bit of a mystery there. Our largest mission, our umbrella statement here, is to support the activities of members in building and enhancing their capacity to reduce and prevent substance use and to encourage positive youth development as an outcome of that, right? So I think of us as kind of the coalition for coalitions. We are a network of coalitions across the Southeast region, and then a part of all of the things that are happening at the state level as well. So AWY, the Alliance for Wisconsin Youth, believes that prevention is a complex process, right? So prevention has evolved to be much more than the DARE program that maybe a lot of us grew up with, right? Prevention touches every corner of our communities just as substance use does. So we believe in prevention as that complex process and as that larger web of all the things that are impacting our community. And so we're situated in a unique position that I'll talk about right here with our org chart. We are the purple little guy there. And so we sit under the state Department of Health Services, Division of Care and Treatment Services, Bureau of Prevention, Treatment, and Recovery, which is a lot of words to say that on behalf of the state, we do some prevention work. And we are kind of liaison between the state and those state health partners and the community. And so you'll see here that below us, we have these regional prevention centers. Obviously, we're in the Southeastern region, but it kind of positions us in this unique space to be at the table with state leaders and advocate on behalf of what we're seeing in communities. And this regional prevention center model is really helpful for helping us to understand what's happening not only in Milwaukee County, where maybe a lot of the news is coming up, maybe a lot of the crime and the narratives around what substance use looks like is different in Milwaukee versus Waukesha versus Washington County versus Jefferson County, right? And so it's a very interesting position to be in, and a great one in terms of advocating for what we're hearing on the ground up to our state partners. So as I said, we have 5 regional prevention centers. We are in the red here in the southeastern region. We are small but mighty. We are the smallest in terms of a regional prevention center, but we have the largest population mostly because of Milwaukee, right? And so we are here, southeastern. Our partners in the northeastern and southern, and then northern and western regions are kind of grouped together. So the northern and western regional prevention center is run by the Marshfield Clinic System. And then our folks with the northeastern and southern, Jody, is out of New AHEC. And so they're kind of doubled up and they work over a much larger region. I do not envy them for that. But yes, so we are here with Waukesha County, obviously, as you're here today. And then we take up Jefferson, Kenosha, Milwaukee, Ozaukee, Racine, Walworth, and Washington counties. And so we have coalitions working on substance use prevention across the entire region. It's a very interesting position to be working in, right? To see that entire landscape across these diverse areas, right? Some more rural than others, some with very different demographics. So it's an interesting space. As I said, we hold 37% of Wisconsin's population. Some days I wake up and I feel like, oh my gosh, that's a lot to be responsible for. But we do our best and we're very well equipped to do so. So we serve 18 community coalition partners in the region. Of course, those numbers kind of ebb and flow each year. A good bit of those coalition partners have drug-free community grants. Some of them are entirely volunteer run. And so these are just a group of community members who care a lot and put some of their time and energy into substance use prevention in their community. So we have a lot of different folks that show up for different reasons, and that's coalition work, right? So our membership requirements, although you don't really need to know this, I think it's helpful to understand kind of the scope of who we're working with. We take any coalition that is working on substance use prevention, meets regularly, and has at least 5 community sectors represented in their coalition. And so we have some coalitions that are really youth heavy. They do a lot of good work with their school districts. Some coalitions that are more focused on health and public health professionals and being sort of a resource on substance use prevention for them. But ultimately, every coalition has that larger coalition structure of being a convener for several sectors. Those are our requirements. The benefits, as everyone would like to know, right? And Terry kind of touched on this, is that we are this network, and so we allow people to network. We are a networking space. We hold quarterly meetings for folks to get together and talk about what they're seeing in their community and some of the initiatives that they're maybe working on, as well, to say, hey, I'm doing this work up in the northern part of our region, and I feel like no one else is doing it. And then when they say that, you'll get someone from Kenosha County or Racine to say, we're doing that, and we can help you, right? So it's a really cool space to be a part of. The bulk of our work, right, and the majority of my job is this training and technical assistance. So we provide support on the strategic prevention framework and helping coalitions to model their work after that framework and under just prevention science generally. And we also are able to provide some financial support for things like the Wisconsin Substance Use Prevention Conference, or some of those other ones that are sponsored by DHS, the CADCA conference. We can provide some financial support to members of coalitions if they are a member coalition of AWY. So it's great to be able to get emails from folks who are saying, hey, we need to fill the gaps here, or we really need training, or someone to come talk about this, and to be able to do that is the best part of my job. And I think I'm very lucky to be able to problem solve for a living, I guess. And then under that, of course, we have access to a ton of resources. I think we work amongst a group of people who are very collaboration minded. And so you'll even notice if you end up looking at our newsletter for this month, that literally went out an hour ago, we included your code of ethics that was established to help guide guest speakers and anybody who's coming in for a training. That is such an important resource that other coalitions are going to benefit from now. And so that's, just a great advantage of being part of AWY. So as we look forward, I promised this wouldn't be a whole presentation. In 2024, one thing I want to highlight is that we are hosting our own substance use prevention skills training. It is a curriculum that is centered on the landscape of Wisconsin. And so the substance use prevention skills training itself is a national thing, right? It's offered across the country, but we have our own Wisconsin curriculum. And so it's really a great resource for folks to be tapped into. It is a 3-day training. So we try to try to get it out early for folks if they still have room on their calendars. It's fantastic. It's going to be hosted by someone who used to be in this role as well. So they have and they wrote the curriculum, right? So like, who better to learn it from than the creator themselves? And so it's kind of a background on prevention science, but really focuses on that coalition heavy context, where it's talking about how do I build that coalition science and the capacity within my own community context. And then of course our newsletters and resources and trainings. I know that we send that out to our contacts within your group, but if there's anybody who wants to be like directly on that listserv, shoot me a message or something and we can get you on there. But those are always jam-packed newsletters as well, full of training opportunities and webinars and just things that we're hearing on the state level as well. So I will
And Kat,
leave.
I will forward you the newsletter after this meeting. I didn't want to forward it before to confuse anybody, but I thought it would mean more to everyone if we did that after you presented. So
that is perfect. That makes complete sense. But I will leave my contact info here. Shoot me an email. I'm happy to connect people with like resources, other folks, anything that you are interested in, or if you have questions about how the structure of AWI supports coalitions beyond your own, anything like that is great. So yes, I will stop the share so that I can hopefully see some
Great.
faces.
Great, thank you. And
yeah.
I'm really excited that you included our code of ethics. Jake and Susie will be sharing that or Jake and Colleen will be sharing that with our team today for the first time. So this is really exciting. So questions for Kat, anything that you would like to ask her about before we move on? Are you hanging with us a little bit?
I do have to jump off in about 10 minutes. So
okay, well, maybe you can hang with us for the first couple of rounds of breakouts then.
Sure. Yeah.
That'd be great. That'd be great.
Perfect.
Okay, super. I just want to note in the chat, I know there's a lot going on in the chat there. So just a quick note, Amanda DeLeon will be back, but she is one of our tri-chairs for one of our teams. And she just noted that the CMS will be hosting an open house at their Pewaukee clinic. So I'll note that as well. And a flyer will come out and we'll make sure that that gets out to everybody as well. All right. All right, so that was a lot of information at you. So we're going to take a couple of minutes to take a breath and do a little bit of networking with each other. So I am going to share my screen so I can walk you through our next steps. All righty, and you guys can see it. All right. So again, it's always hard to do this virtually, but we do want to take a few minutes to ask you a couple of questions, let you ponder for a minute, and then we're going to put you into small groups of 3 for about 5 minutes just to kind of get to know some other partners. So I'm going to pose a question to you, and I'm going to give you 30 seconds to a minute to reflect on the question prompt before we toss you virtually into a space. The breakout rooms will be 5 minutes, and you can keep track. In the upper right-hand corner of the breakout room is a countdown timer, and we'll also send a note maybe when there's a couple of minutes left. We'll send a little message that says just to kind of so you know where you're at. But introduce yourself and your organization and share the answer to this prompt question. So our first question for the first round is, what success did you have in 2023 that you would like to share? So hopefully you have more than one, but if there's a particular one that stands out to you or was particularly meaningful to you, think about sharing that one. So we're going to give you about 30 seconds and just to kind of ponder that.
Terry, is that on any topic or related to the heroin task force?
Great question, Larry. And I left it open to let people decide. It could be something professional. It could be something personal. So this is an opportunity just to get to know people. So great question. Thank you, Labrada. And yes. So Labrada is going to put us into breakout rooms, and I think the numbers between 3 and 4. So there's not a lot of time. So don't watch your airtime, but a quick introduction, your name, your organization, and then the answer to the question. But this is a great opportunity to get to know one another. If there's an email you need to pick up, please do that. And if you somehow can't get that, reach back out to me, and I'm sure I can get you an email for the person that you are visiting with. All right, are we good to go, Labrada?
Yes, and we have actually groups of 2 to 3 folks.
2 to 3 is even better. Fantastic. All right, you guys have a good time. We'll see you in 5 minutes. Welcome back, everybody. I hope that was a good conversation for you. Time too short or too long? It was okay. Okay, good. I am going to share my screen. I'm going to ask you to grab your phones. And again, only if you are comfortable. I'm just using this to help inform
We're back, Terry.
Thank you, Larry. I'm using this to help inform our steering committee as they are designing things for next year. But if you can hold your phone up, can you guys see my screen? Yeah. Okay. So hold your phone up to the QR code. And if you feel comfortable sharing the what is your why, I'm going to invite you to do that. And as they come in, I'll scroll and I will document this for you as well. So you have this information. You can also do slido.com and put that number in and the question should come up. Questions coming up for you guys? Thank you, Labrada. So you can see they're starting to come in. Yeah. So I'll just read a few of these as they're coming in. I have lived experience and want to make a difference and help others. Long-term recovery, filling other people's cups, fills my cup for family, for friends, for my community. Want to break stigma through human connection and education. My career in substance use treatment, staying connected to important community issues. The youth that I serve, making a difference in their lives will impact the future. To keep children safe, long-term recovery, doing what was done for me. Had a friend pass away from an overdose. It's never too late to help change a life. You know, this is why we're here. This is exactly why we're here. Recovery for everyone. I'll let these scroll for a minute so you can read them. So interestingly, this is something that's happening across Slido that I haven't seen. Oops, sorry. Some of the common themes are rolling across the top here. Thank you so much for taking the time to answer the question and for having those conversations. I hope you made some new, built some relationships and met some new partners. So now I am really excited to introduce Stephanie Engel. I've had the utmost pleasure. I guess, Stephanie, you came in around April in this project and we have been really enjoying working. I hope you've been enjoying working with me. I've been enjoying working with you. Stephanie is a social worker who has been hired in to interface. She's with public health, but she's interfacing with public health and the medical examiner's office and will be leading the overdose fatality review process for Waukesha County. So I'm going to turn it over to you, Stephanie, and you may share a little bit about yourself, the process, and where you're heading.
Okay, thank you, Terry. And yes, I very much enjoy working with you. I've learned a lot, so thank you. So a little bit about myself. My name is Stephanie Engel, like Terry had said. My new title is Overdose Fatality Review Social Worker. My background is primarily in child welfare and then a variety of different private and nonprofit agencies, mostly with children and families. And Terry had reached out because she had wanted me to share a bit more information about the overdose fatality review. What is the overdose fatality review? And then sharing a little bit into 2024 regarding our launch. So I'm going to provide a very high level overview with the caveat that a number of people in this room probably know exactly what the overdose fatality review is, because the reason that my position came to be was very specific to being born out of Heroin Task Force. So the overdose fatality review is a nationally recognized model through the Institute on Intergovernmental Research and the Bureau of Justice Assistance. And that model essentially brings together a wide range of professionals across the community, including those with experience. So this team, together, they will work to identify missed opportunities, risk factors, systems gaps, particularly related to those that have lost their lives due to a substance-related cause. And then based on those findings, they will author recommendations, which could range anywhere from proposed policy change to seeking funds, to increased coordinated responding, to educational campaigns. It's really up to that core OFR team to decide how to prioritize their recommendations. My work really more so is to coordinate and facilitate and data manage this project and really help support the direction that this team wants to go. The ultimate goal is to reduce and prevent overdose-related deaths. So some of the different professional partners that are represented on the overdose fatality review range from people with lived experience to the medical examiner's office, to criminal legal representations such as HIDA, DOC, the district attorney's office, clinicians, treatment providers, and prevention and housing specialists, including people on the Heroin Task Force and present today. So from April to now, we have been working very heavily on administrative tasks. So a lot of just the background pieces that we have to have in place before we launch. That's being very heavily guided by corporation compliance and corporation counsel to ensure that we're within administrative code and Wisconsin statute prior to launching everything related to the overdose fatality review. Another person who's been very imperative, and as you hear about overdose fatality review, you may also hear about someone named Amy Perry. Amy Perry is a program manager through the Medical College of Wisconsin, and she has very heavily lifted this initiative throughout the entire state of Wisconsin. So last I looked, I believe we are the 26th site in the state of Wisconsin to be establishing an overdose fatality review. So she provides a lot of training and a lot of technical assistance, and we have depended on her very heavily to launch our Waukesha County specific overdose fatality review. So our actual launch plan, we will be orienting our members, all of our members, which we are over 50 members at this point, on January 18th. And then we will begin putting our different operating structures in place with the goal of conducting approximately 10 case reviews in the 2024 calendar year. My personal goal as the coordinator, facilitator, and data manager is really to just establish our leadership and our operational procedures and structures. It is going to be a year of heavy learning and heavy growing for all of us. So that's what I have.
Perfect. Wonderful. Stephanie, thank you. She is doing a fabulous job. And that logo that I shared when I introduced her is just a touching logo for this process. It really is. So any questions for Stephanie or about the process that she might be able to answer? And many of you are serving on that team, so thank you for your service. Okay. All right.
Terry, I
Then,
have a
yeah.
question for
Oh,
you.
sure.
As that group works at an appropriate time, we'll get updates at some future community partners meetings.
Absolutely. Stephanie probably, I now don't want to speak for her, but I'm sure she would be able to provide us updates quarterly next year, and the recommendations that come out of that team, a lot of them are, I suspect a lot of them are going to land in our purview, if you will. And Francis, I don't know if you want to share anything, Stephanie and or Francis.
Oh, just saying, yes, I totally support that. Happy to liaise on that information back and forth.
Great, Stephanie.
So another good reason to keep coming to these community partners meetings to hear about this exciting new group and what they come up with.
Terrific. All right, so now I have two quick administrative questions, and I'm going to share my screen and you guys can grab your phone again. Our steering committee, we had a little chit chat a couple of months ago, a month ago or so. And my question to you is, would it be helpful for me just to put these 2024 dates on your calendar? I don't want to abscond your calendar or mess up your calendar, but if you guys want them on your calendar, if a majority of people say yes, we're going to just go ahead and do that. So far, so yes. We'll give you guys a second for that. I might still ask for you to register, because even we have 235 people on our email distribution list, and it's really helpful for us to know approximately how many people are coming, so we can create the appropriate breakout rooms and things like that. So I'm going to give you guys another second. There's 22 of you who have responded. So far, no one doesn't want them on the calendar. So I'm thinking the answer is yes. So here's the next question. Keep your phone handy. We are considering June and October to be an in-person meeting. Would you like me to plop 30 minutes ahead on your calendar, as I will make it a separate calendar invite, drive time to location? Okay, we're going to go with the majority here, so we'll see what happens. So about 22 of you are still responding, 22, 23. And it looks like 3/4 of us would like that on your calendar. So what I will do is put that on your calendar. And if you don't want it, you can delete it, I suppose, that drive time. Does that make sense? Okay. All right. So we are going to just take a quick 5 minutes, maybe 3 minutes, 5 minutes. So 3:30, what is it now? 3:33 plus 5 is 8, 3:38. Just to step away from the computer for a minute and let your eyes reset, grab something to drink, and be back. Just turn your video back on so we know you're back. And I'll go ahead and start this, and I'm going to turn the sound off on that. All right, we'll see you in 5 minutes. All right, welcome back. So this part of our meeting is updates from our action teams, but we also want to gather or garner information from you as partners as well. So if there are suggestions or things that you have would like to share with the action team, this is a wonderful opportunity to do that, or some input. So discussion and input. I just wanted to recognize that we have 4 action teams, and it is all out on our website. I'll put that website into the chat in a moment. The Stigma Reduction Action Team, the Support Recovery Action Team, our CHIP Substance Use Team, and our Metrics and Measurements Team. And I also want to recognize and I can't begin to tell you how hard these leaders are working to coordinate the work of these teams. Each team has between 10 and 15 participants, and these tri-chairs are or co-chairs are meeting ahead of their meetings. They're setting up agendas, they're coordinating activities, they're doing an amazing job. So please be sure to thank them when you are working in their action teams. So I'm going to flip right to support recovery, and Joe Keel from Addiction Resource Center and Susie Austin are going to be our speakers. So Susie's the tri-chair and Joe is actually going to be our presenter for today.
Hello, everybody. As Terry mentioned, I'm Joe Keel with the Addiction Resource Council, part of the support recovery action team. Definitely grateful to land on this team with a bunch of great like-minded people. So I've kind of been elected to fill in here and cover some of the topics that will highlight the accomplishments we've had for 2023. I think for starters, you know, part of what's been going on is coming together, first of all, and working together, getting to know each other, and finding a direction and building a strong foundation on the action team, basically, and coming up with those group agreements, examining potential areas of work, and just finding that heading that we needed to move forward. And then we had a pretty wonderful, exciting meeting with Kirk Yakler, where he came in and did a presentation on the medicated assisted treatment, the medications for opioid use disorder, to support transitions during and after incarceration. And that was some pretty good stuff there. Sounds like some pretty good headway being made and more stuff coming in the future. So, and then also a big one and something that we have put together as a team and worked really hard on right in the time for holidays is, a resource guide that we have that will be accessible, which we can share the link, which was we created this collaborative supportive recovery resource document. So basically providing any and all services to people in need, people struggling, families in need. Yeah. So I think we'll share that link so everyone can take a look at that and kind of glance that over, and that'll be available on the website.
Yep, and it's up there already. Librata just dropped it into the chat, and it is this group really, it is a kind of one-stop shop collaborative resource guide. Oh, Joel, sorry.
That's okay. No, that's all right. Yeah, just kind of moving along, looking at our potential projects, plans for 2024. We're still kind of working on the focus, right? Still defining that stuff. And another thing, we'll just be continuing to work on the transition support during and after incarceration, I think is a big one. Really putting our heads together and taking a look at that. And potentially conducting focus groups with those in recovery. I think we see a need there, and we want to bring that to light and hear from people with lived experience.
Great, thank you, Joe. Susie, anything you'd like to add?
I think that you did a great job, Joe. We are putting a big focus on peer support, people that have lived experience, being able to give back, especially when they're out of corrections and out of jail, not just prison. So I think that our focus is, one of our primary goals is to provide peer support to anybody that wants it and that needs it.
Thanks, Susie. So the questions we have for you all to ponder: what suggestions might you have for this team, things that they should be considering, partners who should be at the table? The conversation with Kirk was really awesome. Kirk was able to, there were 2 or 3 different partners, our HTF community partners that he is now networking with to continue to move that work forward. But other suggestions you might have for this team? Or other partners they should make sure are at the table? And while we're talking about these action teams, Librata, I think I have Nicole Bry's email address somewhere. If you can just kind of look through the guide. Nicole is our administrator for the Heroin Task Force. If you are interested in joining any of the teams, it was on the survey, but also if you send her an email, we'll route that to the right person.
You got.
All right.
I have one suggestion.
Yeah.
Hi, thanks, John Kettler, Waukesha County. And I know this is not news to Susie and a number of us here, but regarding the peer support piece, peer support recovery specialists will be billable to Medicaid starting, I believe, in April of 25. So we got a little over a year. And this is a bit of a long-term goal. I don't know, how long the action team will be together, but perhaps some of the agencies here might benefit from sharing, passing through any information on that. So they might sort of be prepared for when that is an eligible benefit as we try to, support the creation of peer support specialists as well as positions for them and what that might look like. So any, kind of guidance in advance, I'm sure would be appreciated by those who might be in a position to bring on peer specialists.
And this is really important for our CHIP team too, because they're looking at this as well. And I'm sorry, you said it was through what was the reimbursement? Was it Medicaid?
Yes. Yeah, right now they are actually billable through Medicaid through the CCS array for those in the CCS program, but not outside of that. They will be soon. And I believe that the target go live date is April of 2025.
Fantastic. Thanks. Thanks so much, John.
Yeah.
All right. All right. I'm going to move us on to our CHIP substance use team. And Bree is going to start us off. And Bree, Francis and I are around here too to support you if there's anything that we can help you with.
Okay, sounds good. Yeah, so we have been following the CHIP process, which is, just I think very different than the way I normally operate. I normally like to get into the action phase right away. And that is not the CHIP process. So it's been really a good learning experience for me, though, because I think what we have found is kind of where we're landing is maybe different than we would have landed otherwise. So as you can see, our end results are on the screen there. We came up with from those end results a couple of indicators for each of them, did the root cause analysis, did some brainstorming with potential strategies. Our last meeting was spent, Francis, there's probably a fancy name, Francis can tell us what it is, but there's a way to kind of look at all of those strategies and narrow down by looking at some of the things we had to look at was specificity, leverage, feasibility, values, and affordability. And really rating each of those
criteria,
each of the strategies against those criteria. So as a result, we came up with, we kind of know what some of those front runners are. Where we are at right now is we've got a survey out to the team where they are looking and deciding where do we really want to focus in on. We're trying to narrow it down to one strategy per indicator, because that will be a total of 4 strategies right off the bat. And of course, if we've got more time that we can broaden that, we will. Just to give you an idea of what are some of the kind of common themes or things that we are seeing. I'll talk a little bit about the one with peer support, since there was some conversation about that already with our last team. We also have identified that we'll probably want to add somebody with a peer support to our team eventually. What really came out of that, some of our front runners were very similar, and it all had to do with education and basically awareness. Letting people know that peer support is a thing. Like John mentioned, it's going to be something that can be paid for with their Medicaid benefit, that it is an evidence-based practice. To let agencies know about it as well. So probably in that area, we'll be doing some kind of education and awareness campaign, I would assume. Some of the strategies we are looking at in what area is this? Lack of education about substance use, harm reduction, and stigma. number of opiate related deaths. We were talking about, you know, again, a lot of promotion and education, letting people know what's out there, that there are safe injection sites, that there are warm phone lines, those kinds of things. So more to come for what we are going to really focus in on in 2024, but we'll be voting on those strategies in our December meeting. And then by January, have our plan in place for the next few years.
Thanks, Bree. And same thing, what suggestions might you have for this team? Or thoughts? And I actually have one, so I'm going to say it before I forget.
Sure.
You know, we have the support recovery action team here in the Heroin Task Force. So Bree, there might be an opportunity for some of these partners to support or maybe take on one of those strategies. So rather than us duplicating efforts, look to the support recovery team as a potential you know, picking up one of those strategies. Francis, I'm looking at you to see, does that make sense?
Totally. Especially Bree, as you noted, your team sort of took on a lot. So that's totally what Heroin Task Force is for. If some of the things that you were gonna do line up with one of these teams, I would love to see the cross collaboration between them, and we can write that right in. So I think that's one of the benefits of this like cross contamination. And we can talk about that more tomorrow too, Bree, at our meeting.
Okay, perfect. Thank you.
Yeah, thank you. That's perfect. I'm just putting both of them in here. Okay, great. Anything else for this team? Bree, thank you. All right, I'm going to turn it over to Jake. Are you still here? Yeah, he is. All right, great. So this is our stigma reduction team. They too have been working super, super hard. I'll let you go.
Hi, my name is Jake. I'm the owner of Turning the Page, one of the chairs for the Stigma Reduction Action Team. One of the first things that we did, we have a great group of individuals, and one of the things that we realized after about 9 months of having our meeting on Tuesdays at 3 p.m. is it coincided with the Substance Use Advisory Committee meeting. So for everybody that's listening, our meetings have now switched to the third Thursday of the month from 3 to 4. And as soon as we made that time change, our attendance almost doubled. So that was really great to have everybody come. We've been working on a couple of things this year. The first, we created a code of ethics focused on stigma reduction for guest speakers presenting to the Heroin Task Force, and we have that in both in English and Spanish versions. One of the quarterly meetings, there was a presenter, there was some triggering language, and we said we can do a better job. So what our team did is essentially create a code of ethics that any presenters can use if they're presenting on any kind of drug or alcohol addiction or mental health. And it's just some ideas and pointers to help make sure that you're using correct and person-first language. The second thing that we did with that is we engaged law enforcement leaders in key discussions about first-person language and stigma reduction strategies. So we were able to have some of the officers come in and they gave us some direction in areas that maybe we can start using some of this language and try to make a difference. We were really looking at where can we start to make the biggest impact, and we thought law enforcement might be where we wanted to start. We hosted a guest speaker at the last quarterly meeting, Rachel Cooper from Shatterproof. She was really great and came in and talked about how stigma impacts people in our community, both living with addiction and not living with it. But just maybe if you know somebody. And it was very eye-opening. We really appreciate it. And she is now on our team and continuing to be a part of our team. We also at that meeting participated in a survey to gauge awareness levels on that stigma. We don't have that survey by any chance, do we, Carrie?
I don't have the information, but it is out on our website under the previous community partners meeting, the September. All of the information is out there on the September quarterly meeting.
Awesome. Rachel and I and the co-chairs are going through some of Shatterproof's documentation right now, and we're really trying to narrow the scope down to make it a little bit easier to digest for people that want something a little bit quicker. So potential projects and plans for 2024. There are a lot of different ways that we can reduce stigma in the community, but one of the ways that we wanted to start was continuing to work with law enforcement. So we've got their buy-in, and now we got to get follow through. So hopefully we can build awareness and educate them. And like I mentioned before, they did give us a couple of links for resources for not only local, but statewide police training, some of the areas where we might be able to put some of this language out there so they can look at it and use it on their own time. We're going to continue working with HTF presenters to use first person language. And again, if anybody out there in any organization has speakers that come in, take a look at this, feel free to use it. It may help stop triggering language or things like that into the future. And we'll continue to work with Shatterproof to utilize and roll out the tools in Waukesha.
So it's also pretty darn amazing that the Alliance for Wisconsin Youth already put that in their newsletter. So it's already starting to have an impact. So, and Joy Evans, I forgot that you came in late to this meeting. So I want to recognize that the other two co-chairs are Joy Evans and Colleen Allen. Colleen had a situation at work she had to take care of, but Joy, I don't know if you can say hey or hi, because she has been an incredible leader with these three as well. So feedback for this team.
And hi, Joy.
Oh, there she is. There she is. Okay, Joy, thank you. I'm so sorry I didn't put you on there, didn't we? Thanks for spotlighting her, Librata.
Yeah, no problem. But I think Jake pretty much covered just about everything. We have been working very hard, and we are excited for the impact that we can make in as regards to stigma reduction in the future, because we think we really got a good thing going. So we're excited to continue making progress. So
Yeah. John Kettler, I think you made the connection with Shatterproof with Rachel for us, and that's really launched quite a few resources that will be coming forward.
Cool beans. Rachel was part of our heroin task force some years back before she left to do some work with the Clinton Foundation. So we were glad to reconnect with her. And yeah, I think she's got some valuable materials for us.
Yep, she's been great. So thoughts or suggestions for this team, same thing. There might be some coordination with CHIP, substance use team. I'm just going to put that in there so we don't forget. But anything else that we want to bring forward to this team, or thoughts that this team should be considering?
I don't know if it would be like overwhelming, but aside from law enforcement, I also think about like engaging with the medical folks in the medical field. So whether that's like clinics that are, already doing that, or clinics that maybe have a lot of folks coming in with substance use. Maybe it's like the free clinics, right? Uninsured and stuff like that. So that's just another idea, I guess.
Yeah, absolutely. I love that. And I am one of those people that wants to jump into the action just as well and do everything. So we made sure to kind of slow down a little bit, make sure we have the right focus and we do it right. And then absolutely we'll expand out. I know Colleen Allen is very excited to bring it to the medical community.
Yeah, and Jake, I'll just add, when Rachel did the survey, what was just astounding to us from a national standpoint is that the medical field, Cal, you nailed it. There was a lot of stigma, language, et cetera, that is happening. They're not taught this information. So what the team has said, because they can't take everything on at once, is that because we have Captain Casta on the team, we decided to start with law enforcement, and then hoping to create whatever it is we're doing with them, roll that to education and medical and healthcare and other fields that are those high areas where we can make a difference. So Cal, you're spot on. Yeah, great. Any other thoughts?
I just have a clarifying question, because I really loved when Rachel presented, I think it was the Addiction Stigma Index. I can't
Yes.
remember if that's, is that the survey that you're referring to that's being offered, or is that something separate?
So she presented information that was national information, but the task force took the survey. So we had, I don't know, what was it, Jake, 37 maybe people from our task force took it. And our task force rated very well on this survey because we're in this world, right? But comparatively to nationally was like almost flipped. Like it was really interesting. I'm gonna while Francis is is speaking for the next, I'm gonna go ahead and head back into our website because I think I have some of that information from her presentation that I can pop into the chat. Thanks so much, Stephanie. All right, so thank you, Jake and Joy, and turning it to Felicia and Francis.
Thanks, Terry. So yeah, my name is Francis, and hopefully in a moment I'll be joined by Felicia. We are the team trying to limit the scope of every other team and make sure that you are taking on work that you can accomplish and measuring it. So we appreciate people like Bree willing to use our process, and appreciate teams like Jake when they mention to us that they're taking on all of law enforcement and all of the medical field, that they listen to our reflections and say, wait, do you have time to do that? So we work, Felicia and I and our team, we work with each team, and we have been working with each team to really find out their data needs. And we've been doing some advocacy to different agencies, specifically in the jail, to find information and try to connect people as best as we can. And we're still doing that work. So we'll continue that all through 2024 as we use that data platform and really get in the good work you're doing so that we can track it over time. Anything to add in that point, Felicia?
No.
We started doing some data literacy. So you might remember a couple meetings ago, we walked through how to read a research article and presented some key points. From that, we really identified that we don't know the data literacy of our group. And that's one of our goals, is to improve your data literacy. And so after that training, we did some searching, and we identified we need to really evaluate where people are in their data literacy journey so that we can appropriately match them with the right resources. If you're really data versed, you don't want intro to data, whereas if you don't usually use data, we need to start from square one. And so we are going to give everyone a couple minutes to fill out a survey, and it's called How Data Literate Are You? We got this survey from the dataliteracyproject.org, and then we just added a couple questions to get some specific information about the Heroin Task Force, but the actual one that measures you is from the Data Literacy Project. So I'm gonna pop that in the chat. Again, you don't need to finish it all right now. You can take it as we're talking, take it after the meeting. We are asking for people's names, so it's not anonymous, but there's no like really telling or juicy question. So don't worry. We just want to know kind of where you are so that we can give you the best resources to help you in your work in Heroin Task Force, but also in your day-to-day work. Anything I missed, Felicia?
No, I would just remind everyone, all the action teams, that we are here to help you and assist you. So as the first group mentioned, focus groups, we're happy to assist in creating data-driven questions that are going to be measurable for you so that you can compare your data, creating that baseline, all those things. Those are what we love to dive into, and we are happy to help you with that.
So that is huge. So that Susie and Joe, you guys heard that they will help us with the questions. Okay, fantastic. I'm typing that in there. Did you guys want to take a minute to have them fill out the survey? Okay, so we're going to take a couple of minutes to do the survey.
And it's going to give you a data persona at the end. This is basically like a data personality quiz. So it's going to kind of tell us what type of data you are. So you can be a data guru, a data apprentice, a data newcomer, or a data avoider. Not one is better than the other, but it kind of gives us the vibe of how you interact with data, and sort of in a fun, lighthearted way that will guide our team to better serve this larger Heroin Task Force team. So don't think about it too much. It's just a personality quiz, but data related.
And it's kind of like being sorted into, like, it's got a Harry Potter vibe for any Harry Potter people out there.
What house are you in?
Yeah.
Will you be able to, as they're taking this at the end, share kind of where we all kind of landed? Okay, fantastic.
Totally. So yeah, at our next meeting, we'll tell you guys sort of some high level aggregate results of where everyone's was landed, and then we can start pushing out some opportunities and education that fits where you currently are with your data.
Fantastic. This is great, you guys. So I did document, take the survey, and that you can help create data-driven questions for focus groups and continue to support the teams. Are there any other questions for the metrics and measurements team? I'm so glad we have you guys. I'm going to put the survey in here. Do you want me to send that out as part of our recap? So okay, I'm happy to do that.
That would be great.
Okay, great. Then I will, is it okay if I keep us moving forward? You
Sure
guys
thing.
are okay with that? Okay, great. All right. So our next part of our agenda is really agency partner announcements or updates. I know we had a couple of them land in the chat, but anything that you would like to share with our community partners? And just unmute unless we start talking over each other. Events that are coming up, resources, anything that is of interest to others, grant opportunities, training, workshops.
Hey Terry, it's Amanda with CMS.
Great. Thanks, Amanda.
Sorry, I don't have my video on. I just switched back on. Sorry I missed the middle of the meeting. I had another meeting. But everyone works from home in my building. So Wi-Fi is crap. So it's either hear me or see me. So I figured you guys would rather hear me. So we finally are going to be doing our open house for the Pewaukee location. And that address is 1610 West Silvernail Road, right there off of Grandview. That's going to be on December 19th from 3 to 6 p.m. So we invite you all to be there. I will send the flyer. Hopefully we'll have it today to the task force so they can send it out to you all. You guys are all more than welcome to come. We'll probably do the ribbon cutting about 3:30. We'll have food. We're going to be using somebody local to the community, but just come see what we're all about. We're an MOUD clinic that's going to be opening up in the community. And yeah, so we're super excited. And we can open up any day. We're just waiting on certain things to come through. And we just wanted to have the open house while we can.
Amanda, thank you. We popped the information that you had before into the chat, and then we'll forward your flyer once you get the flyer.
Wonderful. Thank you.
Of course. And Amanda is also another tri-chair, so she's been working very, very hard with Jim and Susie on support recovery team. All right, other partner announcements. Going once, going twice. All right, then Larry, I think I'm turning it over to you to kind of help us wind down. So give me a second here and I'll share my screen.
Okay. I want to thank the 28 people who are still with us for sticking around. I had mentioned at the beginning, I hope you will get these dates in person. March 12th is going to continue to be virtual, but we're very excited to try an in-person meeting on June 11th. Number one, we would like to see everyone in person. We recognize it's a bigger commitment of time. We're concerned if we'll continue to have as good turnout when we meet in person. So we're going to evaluate how June 11th goes and then decide whether October 1st should also be in person or not. December 3rd, given the time of year, we're definitely planning to be virtual, but we would appreciate any input on your feelings about meeting in person versus meeting virtually, because there's pros and cons to both. One of the big pros of virtual is we've had excellent participation, and it certainly takes less time when you don't have to worry about traveling to an actual place. Terry, was there anything else, or otherwise we're gonna give people some free time unless they want to hang around with us to chat about any?
I just have one little last, question. If you want to grab your phone and just answer, what is one word or a short phrase that's front of mind as we end our last meeting for 23? We'll make sure that those dates get on your calendar. And again, we are incredibly grateful to all of you for working in this field, volunteering in this field, whatever your role is. We are a community coalition doing some amazing work. So we're really grateful to everything that you guys have done. So thank you, and wishing you all a blessed holiday season. Nice. Oh, and while you guys are finishing up this little word cloud, we have created a 2023 accomplishments document that I will finalize and update and get that out to you too. And please feel free to share that and recruit more folks to the team. Any last comments? John Kettler? Anybody else?
No, nicely done. Excited, proud of all the work the teams are doing, and happy holidays, everyone.
Yep. Great. And I'm going to hang. So if you guys want to hang out, anybody wants to have a conversation about anything in particular, that would be great. Oh, and thank you, Francis. All right.
Thank you.
Thank you all. Have a great rest of the evening.